Management of care. 1. After receiving report, the nurse makes initial rounds on the medical surgical unit. Which patient should the nurse see first? A. A patient reporting pain who is receiving pain medication with a tibial fracture. B. A patient who experienced seizures overnight and is now on IV Versed. C. A patient admitted with uncontrolled emesis receiving IV replacement fluid. D. A patient with pulmonary wheezes who is taking nebulized albuterol. The correct answer is A. The patient may be experiencing compartment syndrome. After trauma to an extremity bone, swelling may occur. The natural expansion taking place during swelling is limited by the fascia surrounding the muscle, thus creating compartment syndrome. This will compress the muscle to such an extent that blood flow is compromised. A hallmark of compartment syndrome is uncontrolled pain, despite pain medication in some instances. 2. The nurse is informed of a patient who refuses hemodialysis after years of regular treatment. Which is the best response by the nurse? A. Reassure the patient that everything will work out. B. Tell the patient's family to remind the patient of the importance of dialysis. C. Make the patient aware of the potential outcomes of refusing. D. Chart the refusal and avoid the subject with the patient. The correct answer is C. Making the patient aware of the potential outcomes in a non-judgmental manner will give the client the best opportunity to make an informed decision. Involving the family may cause a dispute. Charting the refusal without counseling the patient is not effective, as the patient needs more information. Avoid false reassurance. 3. When administering soft wrist restraints to a confused patient, it is most appropriate for the nurse to perform which duty? A. Delegate evaluation of restraints to the CNA every 2 hours. B. Perform all of the patient's activities of daily living. C. Secure the restraints with a quick release knot to the side rail at waist level. D. Assess the patient's need for toileting and fluids every 2 hours. The correct answer is D. Delegating evaluation of restraints to a CNA is not appropriate. It is beyond the scope of practice for a CNA to perform patient assessments. The nurse should assist the patient with ADLs, but allow the patient as much freedom as is warranted. Although quick release knots are indicated, they should be tied to a non-movable portion of the bed frame. Assessing toileting and fluid needs is necessary to maintain skin integrity and fluid balance in the confused patient. 4. After returning to the medical surgical unit from transporting a patient, which action should the nurse perform first? A. Evaluate a patient with an IV site that is cool, swollen, and painful. B. Ensure that no new orders have been entered for other assigned patients. C. Perform rounds on all assigned patients. D. Assess a patient with a nasogastric tube who is complaining of stomach pain. The correct answer is A. Although it is part of normal nursing duty to ensure that all new orders are acknowledged and that patients are reevaluated for changes, the nurse should consider patients with changing status first. The patient with an infiltrated IV and potential for tissue damage and infection takes precedence over the patient that may have abdominal distension but is receiving treatment for this expected finding.